everyone. This is Jocelyn Dean. I'm a health insurance advisor. I focus on the under 65 market. I educate. I spend a lot of time with clients on all the options out there, but my main focus is individuals, families, and small businesses, and I help them choose the perfect health insurance option to fit their needs and budget. But I get asked a lot of times about Medicare, and I don't know anything about Medicare. I know it's both health insurance, but it's different. So I focus on under 65, and Medicare is 65 and over, and it's confusing to me. So I work with a couple different people who are experts in that area, and those are the people I call. And so that's why I have brought in an expert today. I brought in Brooks, who's amazing. Whenever I have a question, I have to call him because I am completely lost on that subject. So welcome, Brooks. I'm glad to have you here today.
Jocelyn, thanks for having me. It's a pleasure to be here. And I, again, appreciate our relationship together. And I know that Medicare can be confusing. You know, it's not a one-size-fits-all plan. It's a maze that you have to navigate that can be a nightmare. And I tell folks that my main job is to educate people so they pick the approach that feels right to them.
Yeah, that's awesome. And, you know, we met for the first time, and one of the things that before I started referring people to him, I wanted to make sure that he was a lot like me, where I really care about my clients and my potential clients, and I really spend a lot of time with them, and he is exactly the same way. So that's why we work really well together. So let's start out talking about a little bit about open enrollment or annual enrollment period. I know that that's coming up. When exactly is that for Medicare?
Well, every year is the annual enrollment period in the fall. It starts October 15th and lasts through December 7th. That is the period of time for Medicare that you can change your Medicare Advantage plan and also your prescription drug plan. Prescription drug plan is the Part D, but these plans change every single year. Typically, they'll come out with different, better, newer benefits. Lots of changes this year. The prescription drug component, lots of changes there every year. These formularies on the prescription drug plans can and do change, so it's very important. If you have a prescription drug plan, you typically receive right about this time of year, late September, what is called an ANOC, an annual notice of change, and that tells you, well, we've had some changes in your particular plan. The rates may be going up. The formularies, which is the list of drugs, may be changing. So it's very important to reach out to your Medicare agent and say, hey, help me with this. Let me know if the plan that I'm on is the plan that I should be on for 2021. Because if you don't make changes now, you could be stuck in a plan that might not be appropriate for you.
And if they decide to get their own plan, kind of Google search, do this on their own, what happens if they select that plan on their own and it's really not a great plan? Is there any way for them to switch that throughout the year?
There is not. They can go to Medicare.gov and run a prescription drug plan finder there and do it themselves. And some folks do, and some folks do just fine. But there's barely a day that goes by, Jocelyn, to where I don't talk to somebody that has either made a costly Medicare mistake or is about to. It's just a fact of life. That is no hyperbole. And it's not for the faint of heart. I call that job security because folks rely on specialists like me. I tell people, look, if you become my client, I'll become your Medicare advocate from here on out. I help folks with billing or claims issues. I help folks review their prescription drug plans every year because, once again, that can be a big setback to folks financially if they pick the wrong plan. I'll give you a quick example. I have a client now. She was turning 65. She went straight to a insurance company. She didn't go through a broker like myself. I'm an independent broker. I shop all the plans out there. I don't care where they go. I just want them to be in the right plan. Well, she went to a particular company, and then her financial planner referred her to me just to confirm her the plans that she picked out. And I talked to her. I said, well, listen, there's a exact same plan out there with a company that's just as big and just as reputable for $30 less a month. But not only that, here's the kicker. This insurance company, she got a prescription drug plan from this particular insurance company. Well, I ran a prescription drug plan finder for her, and I found a plan that was going to cost her $5,000 less in her medications than the one that she got with this company. She was on a lot of medications, so it's extremely important that she picked the right prescription drug plan. Well, she just went blindly into this company's prescription drug plan. Just because you're on Company A's Medicare supplement does not mean you have to be on Company A's prescription drug plan. They're that different.
It's crazy. It's a same thing with the under 65 market. I tell people all the time, please call me, because if you choose the wrong plan, you can be stuck with that, and it may not be the best fit for you, especially for prescriptions or maybe a certain doctor that you want to see. It's really important to have someone helping you.
Yeah, right. So lots of changes this annual enrollment period. One of the biggest changes is that these Medicare Advantage plans in the past, up until this year, they did not cover end-stage renal disease, ESRD. So starting in 2021, that's going to be some relief for some folks that are in dire need of a good Medicare Advantage plan. There are some plans out there that will be coming that will be covering end-stage renal disease. So that's probably one of the biggest changes. And a lot of these Medicare Advantage plans, they'll cover things that original Medicare does not cover, like dental, vision, hearing, transportation to and from the hospital. Those are just some of the extra benefits, if you will. Okay. You see a lot of commercials for Medicare Advantage plans. It's constantly on TV. You see Joe Namath, he's talking about, zero premium, this and that.
Right.
Medicare Advantage plans, they were created in 1997 by the Balanced Budget Act of 1997. The reason they were created, Jocelyn, is because not everybody could afford a Medicare supplement, a supplement which fills in the gaps of original Medicare, because there are big gaps in original Medicare. For instance, in Part A, there's a $1,408 deductible as soon as you go in the hospital. And that's actually a per confinement deductible. If you go in a second time, separated by 60 days, you'll owe that $1,408 again. Now, these Medigap, or also known as Medicare supplement plans, they fill in those gaps. Now, Medicare Advantage is a totally different animal. You've heard of Part A, which is hospital, Part B, which is outpatient, okay, Part D, which is prescription drug plans. Now we have Part C, which is Medicare Advantage. Medicare Advantage, Jocelyn, is nothing more than private Medicare. For folks that are on a Medicare Advantage plan, they are no longer on original Medicare. Now, they're still paying their Part B premium in most instances, but they now rely upon a private insurance company like the Aetnas, Humanas, United Healthcare's, Cignas, Kelsey Care Advantage here in Houston to be their Medicare carrier, if you will. They, by law, have to cover everything that Medicare covers, and they can add extra benefits. But it's important to know the difference. With original Medicare and a supplement, there are no networks. You can go to any doctor, any hospital, as long as they take Medicare. And that's the vast majority of doctors and hospitals in this country. With Medicare Advantage, it is managed care, HMOs, PPOs. That's how they control those costs. Not that that's a bad thing, it's just that you have to know and be aware of that. So typically these plans have zero premium or a low premium of $15 to $20 a month. How do they do that? Well, instead of the government, CMS, Centers for Medicare and Medicaid Services, assuming that risk for that Medicare beneficiary, they transfer that risk to a private insurance company like Aetna, Humana, et cetera. The government pays, on average, give or take a few dollars, about $1,000 per month per enrollee to manage that care for that enrollee, that Medicare beneficiary. And again, they do that through the HMOs or PPOs. If you go outside of an HMO network, guess what? They're not paying anything. If you go outside of a PPO network, your responsibility will be greater.
Right.
We're fortunate in Houston in that we have great networks in and around Houston. We have a great medical center. Some of the issues, though, can be if you are diagnosed with a significant health event like a heart attack, stroke, or cancer, you'll hit your maximum out of pocket on a Medicare Advantage plan. But these plans work very, very well for folks. They become very popular. I think in Houston, they're about 40% of the market. That's how popular they are. You just have to know exactly what you have. Original Medicare A and B with the supplement is like a pay-as-you-go plan.
Okay.
A Medicare Advantage plan is a pay-as-you-get sick plan. So you'll have your co-pays and co-insurance and deductibles on that. So that's really one way to kind of look at the difference between the two plans.
So Medicare Advantage is Medigap.
No. And I listen,
This
Jocelyn,
is really confusing.
It's very confusing.
And I sell insurance. This is still confusing.
So you've got two ways to go when you turn 65 or you get off of your group health plan.
Right.
Option A is get Part A and B.
Okay.
And to fill in those gaps of Medicare Part A and B, to get a supplement, also known as a Medigap plan.
Okay.
It'll pay for all those gaps. Plan G being the most popular, and Plan G pays for everything except for the Part B deductible, which for 2020 is $198. The second option is you're still going to be in Medicare Part A and B, except Medicare paying your bills, a private insurance company like Aetna or Humana.
Okay.
That's Medicare Advantage. Option one, no networks. Option two, HMOs and PPOs to manage that care. So yeah, it's very confusing. Once you get in to a Medicare Advantage plan, one thing is very important to know. If you originally get into a Medicare Advantage plan and you decide several years down the road that you want to go back to a supplement, you'll have to answer health questions. That's called underwriting. So the decisions that you make when you go into Medicare is extremely important. Don't do it on your own. Seek out a specialist, someone like myself. Make sure you know all your options. You do have a trial right period, the first 12 months, should you go to a Medicare Advantage plan. If you decide within those 12 months that it's not for you, I want to go to a supplement, you can do it without answering any health questions. Some carriers even give you 2 years to make that decision, to kick the tires, if you will. So lots of decisions to be made, lots of things to know, lots of landmines to not step in. So yes, it's daunting to say the least.
It is very daunting. It's confusing, but what's great is Brooks really makes it a lot easier. Anytime I have a question or one of my clients have a question, because a lot of times I have a client and their spouse is Medicare age, and so that's why we work together a lot. He's awesome at explaining it all and trying to make it simple, but the main thing is please don't try to do this yourself. Use an agent, advisor, like we are, because you don't want to do it wrong because it can really mess things up. So you want to do it right the first time. Is there anything you would like to finish up with? We have about a minute or two left.
Well, again, just to reiterate, I threw a lot of stuff out and a lot of numbers. Typically, when I work with somebody, I take them from point A to point Z very slowly, very methodically, doing a lot of Zoom meetings now. And I show people, on a graph, this is what Medicare covers, what it doesn't cover. This is the way you fill in those gaps. These are your different options. This is what it's going to cost you. So I take people through that, and like I say, people that become my clients, I become their advocate for the rest of their lives for all things Medicare. They love that. They want the high touch. I'm always there for them because they need that. Folks need that high touch. They want to make sure that somebody is going to be there for them.
That's exactly right. So I know that a lot of you probably have some questions, which is great. We love questions. Put them in the comments, and one of us, Brooks or me, will answer your questions. We're happy to help out. So definitely put those questions in the comments below, And I want to thank you so much, Brooks, for being on today. We're excited. Maybe we'll do this again soon, especially if there's a lot of questions. We can come back on and answer some of those questions live. So thank you guys, and have a great day.
Thank you, Jocelyn.
Thank you.
All right.